Tests to confirm enteric fever, typhoid. To confirm typhoid fever, doctors typically use blood cultures to identify the Salmonella typhi bacteria. Complete blood count, CBC, also detects typhoid. Other tests like stool and urine cultures can also be helpful, especially in later stages, or for identifying carriers. Positive serological tests, such as Widal and Typhidot, are not recommended for diagnosis of enteric fever. Let's discuss it in detail. Culture tests. The culture of Salmonella typhi can be done from many body fluids, such as blood, bone marrow, urine, rose spot biopsy extracts, duodenal aspirates, and stool, while the blood culture remains the mainstay of definitive diagnosis. Blood culture. Blood culture is the gold standard test for the diagnosis of typhoid. It must be sent before starting antibiotics. Blood cultures are positive in 40 to 80% of cases, usually in the early course of the disease. In case of a positive blood culture, a report with organism identification and antibiotic sensitivity testing will be available in as early as 3 to 4 days. A negative culture does not exclude typhoid and may warrant a repeat blood culture if the fever is not responding in 7 to 9 days of commencing treatment. Culture of bone marrow aspirate. If antibiotics have already started, then the better test will be culture of bone marrow aspirate. Culture of bone marrow aspirate is 90% sensitive until at least 5 days after starting the antibiotics. However, this technique is extremely painful, which may outweigh its benefit. Stool and urine culture. Similar to blood cultures, stool and urine samples are tested for the presence of Salmonella typhi. Cultures from stool are usually not positive in early disease. Stool and urine cultures are particularly useful when the infection is suspected to have spread to the intestines, or for identifying carriers. Complete blood count, CBC. In typhoid fever, the white blood cell count is often lower than normal, a condition known as leukopenia. This contrasts with many other bacterial infections, where WBC counts tend to be elevated. In typhoid fever, the WBC count is often reduced, sometimes significantly. This reduction can be due to a decrease in the production of white blood cells or an increase in their destruction. CBC may also show anemia, low HB, and decrease in platelets. Serological tests. Serological tests, Widal and Typhidot, are not recommended in the diagnosis of typhoid. Both have low sensitivity and specificity, and do not provide information on antimicrobial sensitivity.